Hey everyone, I'm your super dentist and welcome back to my channel. We've all been there. You take a sip of cold water or bite on something sweet and suddenly you feel something. Sometimes it can be more than a zing, it can be a throbbing pain or maybe a pressure that just doesn't go away. Here's the truth. Your teeth is trying to speak to you and pain is their language. But the type of pain you feel tells a completely different story about what's happening inside the tooth. Hence, today we are going to be a dental detective. I'm going to help you translate those pain signals so that you can differentiate between a simple sensitivity, nerve inflammation or a serious infection. Let's dive in. First up, let us talk about the sudden sharp lightning bolt pain. We call it sensitivity or dentin hypersensitivity. Here what it feels like. You feel like a quick, short, sudden shock that happens only when it is triggered. Usually it happens when you have something cold or hot or something sweet. But the key here is the moment you swallow that drink, the pain is gone almost instantly. Here's the signs. Your tooth is covered outwardly by enamel. Underneath this, there is a layer called as dentin, which is soft and has multiple micro tubes which is directly connected to the nerves inside. So when the enamel weighs down or the gums recedes, these dentin is exposed. Now imagine you keep the window open in the middle of the winter. When the wind blows, it hits your nerves. In a very similar fashion, when a cold hits your exposed dentin, it becomes very sensitive. Usually it doesn't mean that tooth is dying. It just means that dentin is exposed. Now let's move on to a more serious signal, a throb. Here's what it looks like. This isn't a quick zap. It is a lingering, dull ache or a heavy throbbing pain. It feels like a heartbeat inside your tooth. Now this might hurt spontaneously, that is without any stimulation, or the pain can linger even after you finish your meals. Here's the science behind it. It is called as pulpitis. Inside your tooth, there is a chamber which is filled with nerves and vessels which is called as pulp. If you have a deep crack or a cavity, the bacteria can get into this pulp chamber and set in the inflammation. Whenever there is an inflammation, the tissue swells up. But here's the fact, the tooth cannot expand, hence the tissue inside the tooth applies immense pressure, creating intense pain. This is your body's check engine light flashing red. It means that the nerve is damaged and it requires a professional help. Finally, we have a scenario that we need to avoid, that is abscess. Here's what it looks like. This is a constant severe pain that keeps you awake at night. You might find it painful while biting on the tooth or just touching it. But the biggest giveaway, either swelling in the gums or the face or a bad taste in the mouth or even a fever. Now here's the signs. This means that the pulp inside has lost the battle and died. The bacteria that is present inside the tooth has escaped the tooth and entered the jawbone, creating a pocket of infection called as abscess. Now this is a true dental emergency. You cannot just brush it away, or antibiotics alone cannot fix the root cause. You need to see the dentist immediately so that he can drain the infection and save your tooth. So here's the review about the different type of pain. If it's quick and sharp, then probably it's sensitivity. If it's lingering throb, then it can be pulpitis or an inflammation. And if it is constant severe pain with a swelling, then it's probably abscess or infection. Remember, you are the best monitor of your own health. Knowing these differences will help you feel less anxious and help us serve you better. And that's it for today. If you like this video, please share it with your friends and family. If you have any doubts, please drop it in the comment below. I would love to answer your queries. Do not forget to like and subscribe. Thank you for watching. See you in the next one.